Gestational diabetes is a type of diabetes that develops during pregnancy, causing high blood sugar levels that can affect both the mother and baby. It usually appears around the 24th to 28th week of pregnancy and happens because pregnancy hormones make it harder for the body to use insulin properly. When insulin isn't working well, blood sugar levels rise, leading to gestational diabetes. Unlike type 1 or type 2 diabetes, gestational diabetes usually goes away after birth, but it increases the risk of developing type 2 diabetes later in life. Most women don't notice any symptoms, which is why doctors test for it during pregnancy. However, some may experience increased thirst, frequent urination, fatigue, or blurred vision. Since these symptoms can be mistaken for normal pregnancy changes, routine screening is important. Doctors diagnose gestational diabetes with a glucose challenge test, where a pregnant woman drinks a sugary solution and her blood sugar levels are measured. If levels are high, a second, more detailed glucose tolerance test confirms the diagnosis. Gestational diabetes occurs because pregnancy hormones like estrogen, cortisol, and human placental lactogen interfere with insulin, making it harder for the body to regulate blood sugar. If the pancreas can't produce enough insulin to compensate, blood sugar rises. Some women are at a higher risk, especially those who are overweight, over 25 years old, have a family history of diabetes, had gestational diabetes in a previous pregnancy, or have polycystic ovary syndrome, PCOS. If left untreated, gestational diabetes can lead to complications such as high birth weight, where the baby grows too large due to excess sugar, increasing the chances of a C-section or birth injuries. It also raises the risk of preterm birth, low blood sugar in the baby after birth, and breathing problems. In the long term, the baby may have a higher chance of developing obesity or type 2 diabetes later in life. For the mother, gestational diabetes increases the risk of high blood pressure, preeclampsia, and type 2 diabetes after pregnancy. Managing gestational diabetes involves healthy eating, regular exercise, and monitoring blood sugar levels. A diet rich in lean proteins, whole grains, vegetables, and healthy fats, while avoiding excess sugar and refined carbs, helps keep blood sugar stable. Regular exercise, such as walking, swimming, or prenatal yoga, improves insulin function. In some cases, if lifestyle changes aren't enough, doctors may prescribe insulin or oral medications to control blood sugar. After delivery, blood sugar levels usually return to normal, but it's important to get tested for diabetes 6 to 12 weeks after birth and continue monitoring regularly. Women who had gestational diabetes should maintain a healthy lifestyle, as they have a 50% chance of developing type 2 diabetes later in life. Breastfeeding can also help lower the risk of diabetes for both mother and baby. Gestational diabetes can be managed with proper care and lifestyle changes, ensuring a healthy pregnancy and reducing risks for both mother and baby.